Hi, my name is Michelle Ardaby, and I'm the Director of Workforce Wellbeing in the Division of Human Resources at Cornell University. 2020 has obviously been full of challenges for faculty and staff, both at work and at home. The pandemic and other world and national events has left many of us feeling tired and a little bit weary. It's not unusual to hear someone say, "I'm feeling burned out right now." The reality is that burnout is a serious health and wellness issue, as well as a workplace issue. Today, I'm joined by three Cornell health and wellness experts to discuss the issue of burnout, what it is, how it shows up, and what we can do to both prevent and to treat it. I'm joined by Dr. John Clark from Occupational Medicine at Cornell Health, an MBA student with the Johnson School of Business, Carrie Howell, Director of Cornell Wellness, and Jeremy Stewart, Nutrition and Health Outreach Specialist. John, let's start with you. Much research has been done about burnout and the physical manifestation of it. Is burnout an actual clinical diagnosis? How is it defined, and how prevalent is it?
Yeah, great questions, Michelle. According to the World Health Organization, burnout is not classified as a medical condition. It's included in the International Classification of Diseases, the ICD-11, as an occupational phenomenon. It's a syndrome resulting from chronic workplace stress that has not been successfully managed. Burnout is quite common. In the United States, 51% of workers have felt burnout at least once. 77% of professionals report feeling work-related burnout. 84% of millennials report feeling work-related burnout, and 64% of workers report feeling stressed or frustrated at work at least once per week.
Thanks, John. I was talking with somebody recently who was telling me that, with all of the work that she's had to juggle over the past couple months and family life issues, she was feeling so tired. She said she was having trouble getting out of bed in the morning. And it made me wonder, what are the most common symptoms or signs of burnout that people should be on the lookout for?
There are three common manifestations. The first is exhaustion or feeling energy or feelings of energy depletion. It can be emotional, mental, and often physical. Then there's cynicism, an increased mental distance from one's job or negative feelings about the job, a sense of dread about work, anger, as well as irritability. Also, the third element is reduced professional efficacy. There can be a sense of reduced accomplishment and loss of personal identity, dwindling passion about work, or feeling like you can no longer do your job effectively may also signal burnout. We each interact with a lot of employees on well-being related issues. There's been so much happening in our world, and the combination of these things can definitely lead to burnout. For me, on a professional level, COVID-19 is dominating my world. My medical specialties are occupational medicine and family medicine. So it's been really difficult to watch the rates of illness and death skyrocket in America when I know there are effective measures that could have brought this under control but weren't implemented. On a personal level, my family and I have experienced the loss of 5 relatives from COVID-19. Three distant relatives died in March, and in April, my wife's parents both died on the same day. My mother did not have COVID, but she also passed away from pneumonia in August, was from an infection. The dangers of COVID are very real to me. So when I see folks acting like it's no big deal or it's a hoax, or when I see the politics, the false information, the disregard for how serious it is, are people even fighting, against wearing masks as well as social distancing? It's like a slap in the face, and it does create stress where I've experienced this, I've lived this, right? But I can't help but wondering, whether my family members would be alive if things were handled differently. Every time I leave the house, I'm very cautious, right? I get nervous that, I don't want to get COVID. I just think about what it would do to my kids, what it would do to my family if I got COVID, after they went through what they did, or after they experienced what they experienced this past year. Yeah, Carrie, what other contributing factors are you seeing with regard to burnout?
John, thanks for asking that. Cornell Wellness staff meet with a lot of people, and in some of those meetings, there are common threads that are coming up that are just depleting energy stores and contributing to this feeling of burnout for people. And many of those have to do recently right now with the election, right? So it's being felt in many ways, and it just feels like for people it's chipped away at their energy bit by bit, and for multiple different reasons, right? And it doesn't feel like it has ended yet. And so something that continues for us with worry and anxiety and stress just keeps compounding that until there is actually an end. So that's one major thing that we're seeing with a lot of people. The other one is COVID related isolation. And that's coming in many different forms. But for so many of us and so many in the community, people really refill their energy stores with personal contact and in person contact. Things like hugging people, touching people, talking to people in person. And right now that's not something that's okay to do, or at least you need to be very cautious with it. So the interactions feel very different. And so it's not feeling the same for re-energizing and revigorating and refilling our cups and our stores. Things like, you see on the news, and you very well, after sharing your story too, John, may have experienced it. When we're trying to take care of loved ones, and they're ill, and there's also the loss that people are experiencing through death of people who they care about, and holding a sign up through a window to let the person know that you care about them, or doing a video conference, just leaves people feeling like they haven't been able to express themselves in the way that they're used to and connect with loved ones in the way that they're used to. So all of these things are just contributing to the mental burnout in people's lives. Jeremy, you also interact with so many people, and you yourself are, working from home right now. What are some things that either you experience or that you've come across from people who you've interacted with that are things that are also leading to burnout?
Yes, thank you for kicking that question over to me, Carrie. Like you said, I meet with tons of individuals on a daily basis, and I also have kind of experienced a lot of these feelings too from being at home. And one of them is trying to parent through this pandemic and working from home. I myself have a toddler right now, and trying to raise a toddler and also work. I have a fur baby as well. I have a little puppy as well. So having to manage both work along with trying to parent can be extremely difficult for people, and you never really feel like you ever walk away from that work life. There is no work from home separation. You're always playing three different roles, which can definitely lead to you feeling burnt out. Another thing that I'm seeing, and one that personally hits home for me, is what's going on in in America right now with social justice and racism, right? So obviously we're having these conversations. We're at this tipping point in our country right now, and for many years, Black people and other people of color have been discriminated against, and now we're seeing more people on TV being killed in the streets by public officials, right? And this can lead to feelings of trauma coming up for many of people. I know myself, I grew up in a small rural community that was predominantly white and experienced much racial trauma as a child. And this can bring up a lot of feelings, especially now that we're trapped in our homes and we have to deal with it. We're not able to go out and kind of get away from that. We have to sit with that feeling. And then we couple this with being isolated from our friends and family, ones who we connected with to hopefully get over these things. So that can definitely, all these things put together can definitely lead to somebody feeling burnt out. Michelle, as in terms of workload concerns, have you seen anything with employees that you engage with?
Yeah, I mean, thank you for that, Jeremy. I think from a workplace perspective, Cornell faculty and staff have stepped up so immensely this year. I'm really proud to be working at Cornell. People are so passionate about the work that they do and what their work involves, whether it's service to students or the campus environment. And folks, even when you're feeling super passionate about your work, if you're not taking time to rest and rejuvenate, it can lead to issues of burnout. Even when you love your job, feeling burned out doesn't necessarily mean that you don't enjoy your work. It just means that there are other things that might be going on that require some attention. And I think that, for a number of our employees on campus, there have been extra responsibilities as a result of COVID. Helping our campus be ready to welcome back the students safely this fall required a lot of effort. Of course, we have the on-campus COVID testing laboratories. We have all of our wonderful colleagues in student and campus life, helping students have a positive experience this year. Our human resources community has been very busy. And just to be very honest, that work sustained over time without a break can really take a toll. So I think it's important to acknowledge that we can both be, a community of high performing, excellent professionals, and we can also experience burnout at the same time. The last thing that I just want to mention that hasn't come up thus far is the number of employees that we have that are elder caregivers, adult caregivers in our community. Jeremy, you mentioned parenting. We have a lot of folks here that are caring for loved ones either locally or from a long distance. And the realities around travel and access to medical care and those types of things have created challenges. And as Carrie said, those that have lost loved ones, particularly elderly members, there's a lot of grief and loss associated with it that is experienced differently in today's environment due to all of our social distancing rules and things like that. So obviously, combine all of our answers, and there's a lot going on. There's a lot going on for folks that can lead to burnout.